In this session, we will be discussing about fluoroquinolones. Okay. So the first quinolone that was available was a compound called as Nalidixic acid. Okay. So later, various fluoroquinolones were introduced to the market, of which as of now, the available quinolones, fluoroquinolone that we have is Levofloxacin, Norfloxacin, okay, and Ciprofloxacin, Levofloxacin, Moxifloxacin, and another molecule called as Levofloxacin. Okay, Levofloxacin. So the main molecules that we use in our clinical practice is Ciprofloxacin, Levofloxacin, and Moxifloxacin. Okay, Ofloxacin and non-floxacin are also available in India. Now, the advantage of fluoroquinolone antibiotic is that they are antibiotic with excellent oral bioavailability. Okay, bioavailability, which means that they can be given as oral and it attains a very good serum concentration after giving through orally. They have large volume of distribution. Okay, an antibiotic with large volume of distribution distributes well into the tissues. Okay, like tissues like prostate, lung, bone, etc. Okay, so it will penetrate to these tissues. So if you have a prostatic abscess, if you have a pneumonia, if you have an osteomyelitis, etc., these drugs will penetrate well into these tissues and have an excellent antibiotic activity there. So the second advantage of the quinolone antibiotic is as they have an excellent volume of distribution and they have broad spectrum of activity. They can have action on both gram positive as well as gram negative organisms. The pattern of which how much effective it against gram positive and gram negative depends upon the quinolone, the type of quinolone that is used. We will discuss about that later. Okay. Now, next is a mechanism of action. Okay. So, mechanism of action of quinolones is by inhibition of DNA synthesis. Okay. They inhibit DNA synthesis. And how do they inhibit DNA synthesis? They inhibit two enzymes which are involved in the DNA synthesis. We just have to remember the names. That is, one is gyrase, DNA gyrase, and the second is topoisomerase 4. Okay, topoisomerase 4. Now, these two enzymes are required for the DNA synthesis, and the fluoroquinolones inhibit their function, and as a result they will inhibit the DNA synthesis. Okay, so something as I've already told, another thing which we mentioned was fluoroquinolones has excellent oral bioavailability. Among the fluoroquinolones, Levofloxacin has excellent bioavailability, that is around 95%. Okay, 95% of the drug which is given orally is absorbed and is available in the tissue. Ofloxacin also has excellent bioavailability, about 95%. Rest of the quinolones also has good bioavailability, but less than Levofloxacin and Ofloxacin. And again, as I told you, they attained a very good concentration in tissues like lung as well as bone as well as prostate, and it is also concentrated in urine as well as kidney, and as a result there are an excellent use of these antibiotics for the treatment of urinary tract infection, except for Moxifloxacin. So Moxifloxacin is not concentrated in urine, it is not used as a urinary antibiotics, whereas Ciprofloxacin etc. have excellent concentration in urine, so they are very commonly used as urinary tract infection antibiotics. Only thing is that many of the enterobacteriaceae like E. coli are resistant to fluoroquinolones in current situation. So you will have to look at the sensitivity before you use quinolones for the treatment of urinary tract infection. An important adverse effect or a drug interaction